Hello everyone, I'm Victor Varghese, psychiatric nurse practitioner, and welcome to my scholarly project presentation on evaluating the effectiveness of implementing a mobile application for medication adherence among psychiatric patients. Committee members, DNP Chair, Dr. John Kern, Community Member, Psychiatrist Dr. Alexander Lanfield, Second Reader, Dr. Lisa Storer, and Dr. Maria Snell, DNP Project Program Director. Study overview, medication application, purpose and aim for the study. This slide outlines the purpose and aim of the current study, which is to explore and quantify the effectiveness of medication app in addressing medication adherence challenges through technology interventions. The primary goal is to investigate how the MediSafe app impacts medication adherence among psychiatric patients. This involves examining the app's special features, including medication reminders, education materials, and adherence tracking to support patients in maintaining their treatment regimen. Given its comprehensive suites and features, MediSafe app is unique position within the array of mobile health application to aid in medication adherence. The study seeks to assess these features' effectiveness in improving treatment outcomes and enhancing patient well-being, filling a critical gap in the existent literature on medication adherence in psychiatric care. Overall, exploring such innovative intervention is crucial for advancing the health of psychiatric patients and proposing viable solution to ongoing adherence challenge. The study explores the impact of medication adherence and potential treatment outcome improvements. Background and significance. It includes improving medication adherence using mobile health interventions, challenges, significance, and research focus. This slide highlights the significance of improving medication adherence using mobile health interventions, emphasizing the need for exploring innovative solutions in healthcare sector. The importance of this exploring is underscored by challenges currently faced in medication adherence. Traditional method have shown limited effectiveness, leading to persistent struggle to ensure the patient's consistency following their medication regimen. Recent research has focused on potential of new interventions, especially mobile health applications like MediSafe, which has been studied for their impact on improving medication rates. The feature of MediSafe app, as discussed in recent case studies, offer practical examples of how mobile technologies can leverage to address these adherence challenges. The background and significance of these interventions are supported by recent literature studies like Lee et al. 2020 on the importance of new interventions, Morales et al. 2020 on the solution provided by the smartphone apps, and Pittel et al. Detailing the features of MediSafe app. These studies provides a comprehensive overview of how mobile health interventions can transformative approach to enhancing medication adherence. Back literature review. Bruce et al., Nye et al., and Weichel et al. 2020. This literature explores various studies that provides insight into medication adherence and impact of mobile health interventions. The finding of Bruce et al. Highlights the effect of mobile health on orthopedic surgery patients and demonstrates a decrease in hospital readmission and shorter hospital stay, which can positively impact patient outcome and patient reported experience. These technologies can empower patients to play more active, meaningful role in improving their outcome in a way that makes sense to them. Research by Ni et al. 2022 evaluates the role of two mobile applications in enhancing medication adherence. This study notes improvement in adherence rate and observed in reduction of blood pressure among patients, underscoring the potential for mobile app to contribute a significant health outcome. Additionally, this study received ethical approval from Duke Health Institutional Review Board. Weichel et al. 2020 conducted a retrospective analysis of uses of medication adherence management mobile app revealed a positive trend in maintaining optimal medication adherence over time. Mobile technologies utilizing gamification, dosage reminder, incentives, educations, and social community interventions is promising strategy for managing medication adherence in actual practice. The collective evidence of these studies forms a foundation for research and points to the transformative potential of mobile health intervention in improving medication adherence and patient care outcome. Theoretical framework includes Dorothy-Oram theory and social cognitive theory. The application of Dorothy-Oram theory suggests a positive impact on medication adherence and patient outcome, highlights the enhancement of patient confidence in their management abilities. The finding of Williams and Dacey 2018 have supported the perceived benefits of such medication adherence treatment. Furthermore, social cognitive theory underscores the importance of self-efficacy and social support when utilizing smartphone application to maintain medication adherence. These theoretical frameworks provide a lens to understand the factors influencing medication adherence among psychiatric patients using smart applications such as Medicine. By exploring individual benefits, social influence, and technology acceptance, insight into the mechanisms that drive behavioral change and determine the effectiveness of interventions are gained. Integrating this theoretical perspective is critical in developing tailored strategies to enhance medication adherence among psychiatric settings. Methods and design. It includes quality improvement retrospective comparative study, samples, group 1, group 2, and selective selection criteria. The study was conducted by selecting participants from an outpatient clinic in Southeast Texas to ensure the representative of local psychiatric patient population. The selection was grounded on specific criteria, including the type of psychiatric diagnosis, the availability of health records for a comprehensive analysis. Demographic data such as age, gender, psychiatric diagnosis, and medication regimen were meticulously gathered from EHR to compile a detailed sample profile. A total of 50 participants were included in the sample size, a figure strategically determined to ensure the statistical power needed for results to be meaningful. Participants were divided into two groups based on the use of mobile app. Those using mobile app formed group 1, and while those who choose not to use the mobile app constitute the group 2. Throughout the study, ethical considerations were utmost important. Approval from the Quality Improvement Institutional Review Board was secured before study initiation. Additionally, stringent measures were put in place to protect the confidentiality of patients' information at all stages of research. Methods and design. Demographic characteristics, sample size, ethical consideration. This slide outlines a study methodology approach, a design specific focused on medication adherence among psychiatric patients. Demographic ages such as age, gender, psychiatric diagnosis, and medication regimen were meticulously collected from healthcare record, providing a robust framework for detailed data analysis. These systemic collections were essential to understand the scope of study scope and variables. The study included 50 participants and strict ethical protocols were observed. Privacy and confidentiality were paramount with comprehensive safeguard for patients' information, aiming for trustworthy valid and ethical, responsible outcome. Methods and design, findings, compliance, data anonymization, data security. This slide provides an overview of method of design utilized in the study, specifically focusing on how different age group and provision of education about mobile health technology impact medication adherence. The study grouped participants by the age to examine tends to difference in how education interventions about mobile health affect their medication adherence rate. Detailed demographic information was used to categorize the participants into distinct age groups, ensuring that the analysis could accurately reflect the influence of age on effectiveness of educational content provided. Each participant received tailored information regarding the use of mobile application for health management with the aim to improve their adherence prescribed medication regimen. The study meticulously recorded participants received education and monitored their adherence rates subsequently. Statistical methods include descriptive statistics, chi-score were applied to analyze the data collection. This approach helped in understanding the correlation between age, education, mobile health, and medication adherence, providing insight into whether age-specific education interventions are necessary. Data handling was conducted with high standards and confidentiality and security. All patients were anonymized to protect privacy. Strict data management and protocol were upheld throughout the study to maintain integrity and security of the data. Data analysis. Descriptive statistic chi-score. This slide delves into the data analysis method to understand and assess the relationship between patients' demographic, psychiatric diagnosis, and medication adherence. Descriptive data were compiled to summarize the key patients' data, including demographics, medication adherence rate, and clinical outcome. This approach provides a foundational understanding of patient population and overall adherence trend to observe in the study. Following the initial data summary, chi-score were conducted to investigate the relationship among demographics, psychiatric diagnosis, and medication adherence. This statistical method was chosen to determine the significance of association between categorical variables within the study. The analysis aimed to identify any significant pattern of discrepancy in medication adherence that could associate with specific demographic factor or psychiatric conditions. By thoroughly examining this relationship, the study sought to highlight areas where targeted interventions and improve adherence outcome. Overall, the rigorous application of the statistical techniques has enabled detailed exploration of the data, fostering deeper understanding of the factor influencing the adherence in psychiatric patients. Results: MediSafe impact, patient education, age factor, diagnosis correlation. The study reveals significant finding impact of medication adherence, smartphone application on medication adherence among psychiatric patients. Patients educated about MediSafe app demonstrate a remarkable 92% adherence rate compared to 56% of those who chose not to use the application. Age showed no significant association with mobile educations, but diagnosis correlate with education rates. Notably, patients with anxiety and depression exhibit higher education adherence rate, while those with bipolar disorder shows lower adherence. Overall, education played a crucial role in enhancing the individual adherence, emphasizing the importance of tailored intervention in psychiatric care. Results: educational impact, adherence improvement, strategies for engagement, diagnosis, and adherence. The study data analysis highlights the critical role of patient education in improving medication adherence among psychiatric patients using the MediSafe smartphone application. Patients who choose to use MediSafe application demonstrate significantly higher adherence rate than those who did not. This underscores the importance of tailored interventions and patients' engagement strategies in psychiatric care. Additionally, the association between psychiatric diagnosis and adherence rates suggests the need for personalized approaches to address specific patient needs and challenges. Overall, the finding underscores the potential of mobile app intervention to enhance medication adherence and improve patient outcome in psychiatry. Data analysis. This slide indicates the relationship with provision of education on mobile health and medication adherence among different age groups. This analysis displays on slides using chi-score test to assess the significance of this relationship. Observation indicates that education on mobile health has been associated with a higher percentage of medication adherence with each group. For 70% participants aged 20 to 30 who received education mobile adherence to their medication, a pattern that is persistent across all age group varying degree of adherence. Despite the observation, chi-score results indicated p-value suggests no significantly associated between provision of education, medication adherence at different age group, p-value being higher than 0.05 imply within this sample. The data analysis results encompasses 50 participants with 68% choosing to use the mobile app or showing overall higher medication adherence. This suggests that age-specific trends in adherence are observable. The general effectiveness of educational interventions on mobile health may be transcend age groups. Conclusively, the slide highlights the importance of mobile health education in improving medication adherence rate. Suggests that such intervention can be beneficial across the diverse age demographics. This slide indicates about the follow-up and medication adherence. The slide refers to the finding from the study of various follow-up durations were analyzed to see if this impact on how well the patients adhered to their medication regimen. Especially the study looked at 3 different length of follow-up periods, 1 month, 2 months, and 3 months. After collecting the analysis, the data, it has found that length of the follow-up and whether it was relatively short at 2 weeks or longer at 3 months did not statistically significant impact on patients' medication adherence. This suggests that within the study population, the time interval at which the patients were followed by healthcare provider or researcher after the start of their treatment did not noticeable difference in their likelihood to continue taking their medication as prescribed. In other words, for the individual with a particular study, simply extending the duration of follow-up did not improve medication adherence. This could imply that other factors not related with timing interaction may have a more substantial influence on whether or not two patients stick to their prescribed medication plan. This chart shows education provided on different age groups. The slide correlation explores the correlation between the age group, study participants, and education they were provided on mobile health technology. The graphical representation breaks down the adherence rate by age group, showing the percentage of participants who chose to use the mobile app versus those who did not. The analysis include diverse age, highlighting how each age group on mobile health application and in its impact on their medication adherence. It's noteworthy that adherence percentage differ across each group. The general trend indicating education on mobile health contribute to higher adherence rate. Statistical tests such as chi-score utilize the examine the association between provision of education and adherence within the age group. However, 41 to 50 shows a higher adherence rate as compared to 31 to 40 and 51 to 60. But 21 to 30 and 61 to 70 shows a lesser adherence those who choose not to use the app. This slide represents statistical analysis of medication adherence across various psychiatric diagnoses. It provides a detailed count and percentage of medication adherence within each diagnostic category. The data shows variability in adherence rate amongst different diagnoses. For instance, a higher percentage of adherence is observed in patients with anxiety and depression, whereas those with bipolar disorder exhibit a lower adherence rate. Statistical significance is tested using chi-score method. For anxiety and depression disorder, the p-value less than 0. Indicating statistical significant difference in adherence rate with these groups. These results are critical in understanding in which psychiatric diagnosis may influence patients' likelihood to adhere to the medication regimen. The data underscores the need for tailored strategies in managing adherence. They are sensitive to overall specific associated in psychiatric diagnosis. Limitations. Addressing the limitation of this study, these are concerned about generalizability of the results, potential for database, longitudinal analysis limitations. The finding may be widely applicable beyond the specific demographic clinical setting investigated, as the focus was the psychiatric patients from a single clinic. Using health records, data collection introduces a potential for bias. The variability in documentation practical among psychiatric providers can impact the accuracy and completeness of the data extracted. Data also provides only short-term view of the intervention effect. Within a longitudinal follow-ups, the sustainability of the observed improvement in medication adherence over time remains uncertain. Acknowledging this limitation is crucial for guiding future research, ensuring the findings are interpreted and applied appropriately in clinical practice. Discussion. Education and mobile health, adherence rate increase, tailored intervention success, and research corroboration. This discussion highlights the pivotal role in patients' education and mobile health in context of psychiatric treatment. The focus is on the value of informed patients who know how mobile health resources like medication can assist in managing treatment. Data indicates a significant boost in adherence rate amongst patients who were informed or functionality and benefits of medication app. This finding is critical as it spotlights the direct impact of education and awareness on medication adherence. Additionally, the study marks success tailored interventions. These customized approaches enhance the treatment, demonstrating the personalized care in empirically adequate. Diagnosis discussion, diagnosis and adherence link, mental health adherence dynamics, personalization of care, recognizing the barriers. The discussion delves into critical connections and dynamic in mental health treatment regimen, examining the direct correlation between psychiatric diagnosis and medication rates. Complexity in relationship in mental health and medication adherence were explored. It became evident that mental health conditions can profoundly affect treatment adherence, and conversely, adherence can significant influence to mental health outcome. The discussion then shifted to importance of personalization in care, highlighting the need for individualized intervention with treatment plans and considering each patient's unique circumstances, preference, and need to essential enhancing treatment efficacy and improve adherence rate. Finally, the various barriers to medication adherence were acknowledged. Comprehending these challenges is crucial to developing strategies to surmount these obstacles, improving overall patients' care. Discussion, support and education, literature contribution, personalized care approach, care practice optimization. This finding aligned with the previous research emphasizing the positive impact of smartphone application on medication adherence among various patient population. Moreover, the association between psychiatric diagnosis adherence rate sheds on the complex interplay between mental health conditions and treatment regimen, necessitating personalized interventions. However, technical difficulties and age-related barriers underscore the importance of ongoing support and education to optimize intervention outcome. Study limitations, future research, value of care practice. This segment acknowledges the limitations present in the study. Recognizing these limitations is essential in contextualizing the study findings and understanding the areas where additional research is needed to fill the gaps. The necessity for further investigations is underscored concerning the directives outlined by Patel 2020. This call for future research is not only about expanding the current study finding, but also exploring new areas that could contribute in the field of psychiatric care. The study value lies in the contribution of enhancing the care methodologies. Despite its limitation, the finding and observation provide meaningful insight to inform improved current practice. Implication for future research, practical application are substantial and set to stage ongoing advancement in psychiatric care. Implication for practice, role of nurses, education integration, and interdisciplinary collaboration. Nurses are pivotal optimizing medication adherence among psychiatric patients through tailored education and technology. Integration. This provides individualized support on diagnosis, monitor real-time adherence using smartphone application, collaborating with interdisciplinary care for comprehensive care. Implication for practice, technology and care, impact on care quality. This significant examines the use of technology and patient care method, acknowledging their role in improvement technology outcome, psychiatric setting, emphasizing is placed on beneficial outcome that rise from integration of innovative solutions in patient's care plan, which is essential to progression of patient's care statistic and achieving optimal healthcare outcome in psychiatric setting. Implication for future research, study long-term effects, broadens research scope, and focus on usability. Future research directions could include exploring long-term benefits of smartphone applications, further comparative study, employing control groups and incorporating a wide range of demography to enhance the general findings, focus on usability and application of the degree. Additionally, investigating the considering long-term patient's outcome as a result, such app would offer a more comprehensive understanding in the role of technology in psychiatric medication adherence. Evaluating implication of further research, evaluating extended care, measuring the long-term benefits of going beyond immediate assessment period, qualitative research to get from patient's outcome. This section overall indicates technology and patient-centered method for treatment outcome. Integrating tech psychiatric care is not merely an enhancement of traditional practices, but transforming that leads to better outcome. The role of effect improvement and the quality of care highlights the emphasis for this instrumental value in fostering overall wellness. Conclusion. Medication adherence, medicine effectiveness, support from prior research, diagnosis, and outcome. In conclusion, the study presents significant impact of patient education and mobile health intervention on medication adherence among psychiatric patients, explicitly focusing on utilizing the MediSafe smartphone application. The effectiveness of such intervention is apparent as evident by the increased adherence rate who received educations who choose to use the MediSafe app. This aligns the existing research reinforcing the potential of smartphone application to boost medication adherence across diverse patient demographic. Overall, the quality improvement project contributes to valuable insight to existing literature, highlights the crucial importance of personalized approaches in elevating medication adherence and improving overall patient's outcome in psychiatric setting. Last but not are the references. Thank you for watching my presentation.